Okay. So again, very good afternoon. And today we are going to talk about behavioral issues in autism. So before I begin the topic, what comes to your mind when you think of behaviors? Anyone?
Seeing self-injurious behavior.
Sorry, your voice broke. Mhm. Is it me who's not
Behaviors
able? Sorry. The network I think is breaking for whoever was talking. So anyone, whatever comes to your mind. Behavior सुन के क्या आता है दिमाग में? Hitting, screaming, shouting, bhagna. Is that all that comes to the mind?
Yeah, ma'am. Yes, ma'am.
Speech, stimming. Okay. Speech, acting well. None of us think of these things, right? Because whenever we talk of behavior, we only think of negative things. But behavior do not necessarily mean all negative things. Although when we are talking of behavioral issues, then we are talking of whatever negative we are encountering. I hope you can all see my screen.
Yes, ma'am.
Good, thank you. Okay. So see, behavior is anything, the way in which one acts or conducts oneself. Anything, even speech is a behavior. That is why in EBA they say verbal behavioral approach. Okay, so anything that is increasing the verbal behavior of the child. So everything is a behavior. How we act, how we speak, how we sit, how we stand, how we behave with others, how we are conducting ourselves, how we are negatively conducting ourselves. So everything comes under behavior. Behavioral issues are when they become a problem or the problematic behaviors. So, especially in ASD now, how do we differentiate whether they are true behaviors or they are due to the child on spectrum, because of the inherent deficits that the child is having? So, we have to distinguish those things, certain things that we see, like yelling when overwhelmed or frustrated. It is not something that the child is controlling. So, we need to understand this is not a misbehavior but a behavior due to the internal reasons or the sensory reasons. So we need to distinguish what are actual misbehaviors and what are autistic behaviors. So this understanding is very important for us to go in for the behavior modification strategies. So the child who goes from the room or the grandparent comes or anybody comes and they want to hug their child, but the child will just run away or maybe push them away. So it's not that he's misbehaving. Might be, but maybe not. But they can also be a very well reason that there is something else behind it because of the deficits that he's facing. So we need to differentiate that. So why, we see the most commonly what we are concerned about are stimming behaviors. Okay, apart from self-injurious or hitting behaviors or overtly weird behaviors, what we call. So stimming behaviors really affect us. Why these stimming behaviors are happening? All those repetitive behaviors are happening. So what happens in a typical brain? See, on your left-hand side, you see this typical brain. Okay, you see these connections here. These are all synaptic connections. Okay, so in the typical brain, this lens is more than what we see in the autistic. You see uh, the kind of connections that are formed in an autistic brain, and some ones are way large, some ones are shorter. So geodesic length is the shortest length between the synaptic junctions. Okay, so that length in autistic connections, when it gets shortens up, it creates those repetitive behaviors. So repeatedly on the loop, the child is doing same thing, same thing, same thing, because he is just moving to and fro in that same synaptic junction. So he's not able to make it, take it out. The kind of distractions we see, the kind of jumping from one activity to another that we see, because a lot of chaos is created in the brain. And why that is created? Because of the synaptic pruning not happening properly. So when a neurotypical child is growing, we see that some connections are formed, some are broken away with time. So whatever is not required, our mind snips it. So it prunes it, cuts off the unnecessary things. So this pruning is not as effective in autistic brains. So because of that, there are a lot of interconnected channels which are not required, which can lead to a lot of distractions. So my mind wants to say something, something else crops up. I say some other answer for something else because there are too much of interconnectivity which is not required and which creates an atypical pattern of connectivity and behaviors. So what can be the various causes? There can be many causes that can lead to behavioral issues. So I'm only talking about the problematic behaviors here, not the positive ones. So it can be sensory overload. We know that our kids are having sensory issues. So if they have that overload, they have the overwhelming feeling. So this sensory overload can very well lead to problematic behaviors or some weird behaviors, what we see, or the stimming behaviors or out of control behaviors. Changes in routine. It's difficult for our kids to accept sudden changes in the routine. They need to be prepared. They need to learn that this is going to be a transition. So if they're not prepared for those transitions and sudden changes crop up, they sometimes can get overwhelmed, and this can lead to behaviors. Being overwhelmed by multiple tasks. So a child going to school, then coming back, going to therapies, coming back, doing homework, it's too much for him to take. So that ultimately, at the end of the day, leads to overworked or overwhelmed feeling, which the child does not know how to handle. And that leads to a behavior, stress and anxiety, medical causes. So anything going on internally, any pain, any discomfort, gut issues, which commonly occur. So if your gut is not working fine, then you have issues with your behaviors and emotions. Like there was this in Tiku movie, Apka emotion is related to your emotion, and very rightly said, because if you do not have a clear tummy, we also face that discomfort throughout the day. So those medical reasons, any pain that the child is observing and he's not able to observe, that will lead to a misbehavior. Suppose a child is having headache and he's not able to express it. So ultimately, after some time, after tolerating, he might just start hitting or biting or pinching you because he is not able to express what is happening, but he's in pain. Other reasons, frustration, anxiety, so many choices given at the time, lack of communication skills, of course. This we already talked about in our speech and language webinar. So if there are lack of communication skills, again, we see that there will be a lot of frustration and behaviors cropping up. New settings, yes. So whenever a child is going to a new setting, we see explorations happening, sensory overloads happening. So in that new scenario, we might see certain behaviors, and we usually feel the child is so settled at home. What happens to him when he goes out? Because the environment changes, the people change, the reactions change, the sound sensitivity, the visual sensitivity, everything kicks. Being rushed to finish something, sensory and cognitive overload, open-ended questions, crowded places. So anything that stresses or triggers my emotions or my sensory skills, my sensory issues will lead to probably a behavior. So there is a difference between tantrum versus meltdown. So tantrum we usually see for a very particular thing. Temper tantrum is a very common term that we have heard. And meltdown. Okay, before I go to the slide, would anyone like to share what difference do you think is in tantrum and meltdown?
Yeah, ma'am. Tantrum occurs like if they want some chocolate or biscuit, like wantedly, if they're crying or screaming, that comes under tantrum part. And when it comes to meltdown, like they will cry a lot, and though if you give something which they like mostly, like something like TV, gadget, or cookie, they don't take it, they don't eat it. They will continuously crying emotionally, and that will take a lot of time during meltdown.
Hmm.
So yeah,
Right.
that's
So what do you think is the purpose of tantrum and what do you think is the purpose of meltdown? So of course, tantrum is for that particular thing. Why
yeah,
meltdowns are happening?
yeah. Meltdowns will happen maybe if they are emotionally stressed out, and which we cannot understand what they are going through. And yeah, maybe it's because of the lack of expression, and which we cannot understand them properly. And yeah.
Yes. Yes.
Ma'am, I think tantrum is intentional and meltdown is not.
Yes. Tantrum is definitely intentional. Both the inputs are absolutely correct. Just 1 second. Where did my screen go? Oh, 1 second. I by mistake closed the screen. Let me open the PPT. So tantrums are always intentional. They are always directed towards a tangible thing, that there is a purpose behind it. And if you give or fulfill that purpose, then the tantrums go away. There is no more tantrum. The child will be absolutely okay. But in case of meltdowns, it is beyond the scope of the child to control it. It is not a controlled behavior. It is an uncontrolled behavior which is not directed by the child. So it usually happens because of sensory overload, additional things as mentioned, due to the emotional dysregulation, due to the lack of communication. So all those factors are contributing for meltdowns. They will not bargain in that time. You just need to let that phase pass. So there is a huge difference between tantrum versus meltdowns. And many a times for our kids, it is meltdowns, which we treat as a severe tantrum. And in tantrum, in fact, they can, cry for hours or it can last for days if the goals are not met. Lack of skills and triggers. They are common for both tantrums and meltdowns. So when we see that the child is just crying, 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 no matter what, not getting, calmed down by anything. So that most likely you need to check if it is a tantrum. Because in meltdown, it goes through a certain phase and then it comes down. Eventually the child settles down. So let's understand what can be the four functions of behavior. When we talk of behavior, we always talk in terms of functional behavior analysis. I'm sure you must have all heard this term. So why functional? Functional because it is believed that every behavior has a purpose for which it is happening. So it has a function to fulfill. Okay, so that is why functional behavior analysis. So what are the four functions of behavior? Sensory, escape, attention, and tangible. So sensory is whatever is giving you sensory input, you want that, or something that is giving you over input, you don't want that. So whatever behavior is cropping due to those reasons will come under sensory, or the sensory overloads happening, or sometimes in the new environment, or sometimes anxiety levels increasing a lot, or emotional levels increasing a lot, excitation, excessive excitation. So all these things come in sensory. Escape, when the child does not want to do something. It can be because the task is maybe boring or not appealing to the child, but can also be that the child does not have enough skills to perform the task. So it can also be the lack of skill why the child wants to escape. Or he has something else on the mind and he doesn't want to stay there for the task. Then attention. So he wants attention from you or from other people or from anybody. So the target will be decided by the child based on the situation, but it is the social attention that is required. And tangibles refers to the objects or edibles or anything quantified. So any object pertained function refers to the tangibles. So let's see the cycle. This is the typical meltdown cycle. What happens during a behavior cycle? So when you're on number one, okay, so this green zone is where the foundation of your plan lays. Whatever behavior modifications have to be done, whatever has to be taught to the child happens in this green zone. Once the child starts reaching two, so this is escalation zone. Okay, so here you will see the sign of early stress, which might be seen, which might be recognized, which might get missed by the caregivers also. But this is the best time to focus, because if you catch it here, you can immediately bring it down to level one. Now you see the escalation further happening. So it is the time, if the trigger is not removed, the child will move on to the crisis stage. Then if it is not removed, the child goes to fourth stage, where his emotional regulation is just on the verge of, he's on the verge of losing his emotional regulation. So there, if you do it and provide a calming strategy, there is a chance that the child might return to not immediately stage one, but 3, 2, 1. And if this is crossed, then the child will go through stage 5, which is the crisis stage, or the rage. I'll tell you the other terminologies also. So this number 5 is where you see the peak of the behaviors: throwing, hitting, biting, crying, saying anything which does not make sense. So here you cannot do anything. Better to remain calm. Don't use too much of language, and let this phase pass. Once this phase passes, then the child goes to the de-escalation cycle. Here, then he starts calming down a little bit. And here you can just be there to make the child relax. When he relaxes down further, then you need to see what strategy I can employ here. If he needs a sensory input, I give a sensory input. If he needs a calming strategy, I give a calming strategy, or use supportive words. And then when he goes to 2, then we use the calming redirection and see if the child can come back to the work. Okay, and at 1, once he's at this stage, we can resume our work. So in every meltdown, you will see these stages coming. So further simplifying it, so the child is going through the routine, then comes the rumbling stage. Rumbling stage is where you can identify the signs and you can revert it back to recovery. But once this rumbling stage is crossed, then you cannot do anything. The child will go through that rage phase. And once that rage phase is over, then it will come down to recovery. Now, this rage phase is not too long when it comes to sensory. Okay, it just takes few minutes probably. But if it is a tantrum, the crisis phase or the peak phase can last for a very, very long time. And after recovery, it is back to routine. Now, what is this adult curve? So adult curve is what the adult in situation there is supposed to behave. So how am I supposed to behave when the child is going through all these phases? So I need to maintain my patience. My curve is much lower than the child's, because I need to first behave myself so that I can ask or expect or control the child and take care of the child, that he goes through the phases and remains protected and can recover faster. So if I am letting my curve go up, it is going to exponentially go for the child. So adult curve is important to be taken care of. If we are adults are not doing it, then children cannot do it. So understanding this ABC functional analysis. Okay, so how do you do it? See, every behavior, as we discussed, has a function. So when we are talking of behaviors, okay, my child is doing this, my child is hitting or biting, or the moment I take him to the tabletop or the activity, he starts shouting at the pitch of the voice, or sometimes he'll just come and start hitting me like that. So I have to identify what is the function of the behavior. So as we've already discussed 4 functions of behaviors, so you have to very clearly identify which function is the behavior fulfilling, because based on that you will employ your behavior modification strategies. So this functional behavior assessment is very important, and as a parent also you can do it very well, except if there is something that you are not able to understand. Okay, so this is a format. Basically, we talk of ABC analysis. ABC is first antecedent. So antecedent is what just happened before the behavior. What was the scenario that was created just before the behavior occurred. Then behavior, in this particular section, you have to write what actually happened. So antecedent, what happened before. Behavior, what did you see or hear? So what happened during that behavior? And consequence, what followed. So based on that, we have to choose whether it was escape, attention, tangibles, or sensory. So for example, no, I'll come into the behavior. So when you're making this behavior plan, first you have to identify the behavior. So like an example given here, Liz is always blurting out in the class. So what is the function of this behavior? So the function that was identified was attention. She's seeking attention. So the desired behavior, what we want is that she should raise her hand to take permission. What is, now you have to employ two plans, proactive and reactive. Proactive, if we are using it and it is working accordingly. Reactive, if it is not working accordingly, then we are what we are going to do. So proactive, we are using cool points chart or the token chart or the reward chart to allow self-monitor, and as many times as she's getting tokens, she gets rewarded. Reactive plan, if she still continues to blurt out, behavior will be ignored first 2 times. After that, teacher will correct by verbal reminder. Reinforcers used for the proactive plan. This is not for the reactive plan. Reinforcers used based on the preference of the child. And data collection is done like what is the frequency of the behavior. And this is monitored depending upon what is the intensity of behavior in question. Okay, so when you're making a behavior intervention plan, you need to take care of all these things. Another example of this ABC analysis. So this was identified as some fellow instructed Amanda to wash her hands. So this teacher was telling the child to wash her hands. The situation was that they were both near the sink where the child was instructed to wash the hands. But the child started screaming and stormed her. So what did the teacher do? She just spoke to her calmly and redirected her to pick up the soap. So Amanda continued to scream even louder. So here, don't worry if the child is going on to escalation, because it will first reach a peak. It has to reach that extinction phase before the behavior can go away or fade away. Sometimes we see that when we are going for behavior corrections, there is a further increase in behavior and we feel that it is not working. No, the behaviors, whatever we want to change and we bring it to the desired behavior, it will first increase. For example, suppose, you want your child to sleep in a separate room. Okay, so you take the child to the bed on a separate room and the child starts crying. But this will happen one day and then you will start, rush and run and reach the child and immediately soothe the child. So this behavior continues for days in and days out. Now, the child knows as soon as I cry, you will come running. So one fine day you decided, I'm not going. So when you're not going, the screaming continued even louder because it has to go through that extinction phase. Now, when it has gone through the extinction phase and the child feels that no, she's not going to come. So the child self-calms and goes to sleep. So that was just that breaking point for that behavior. Same thing if you're asking the child to write, the child is not writing, making the hand stiff. You have to just, stay consistent and let that behavior go through, reach its peak and then break it and we get the work done. But you need to break. So this phase of tussle comes between the child or the parent or the child or the therapist, and you have to let that extinction phase go and tackle it very carefully so that it breaks and there is a reduction in the behavior. So now the child is in the rumbling stage. So what can I do as an adult? You can remain calm, use a quiet voice, take deep breaths. Here the key is that we don't lose the patience. Basically, prevent power struggle. You do this, I do this, not going to help. Reevaluate goals. Reevaluation will be done at a later stage actually, and be flexible. Okay, so As an adult now, you have to take the responsibility that let me try that I can bring back child from the grumbling stage itself before it proceeds. Sorry, it proceeds to rage stage. Okay. Now, when it is in the rage stage, what do I do? Control flight or fight tendency. So control your emotions first and foremost. Don't get panicked. Don't get scared. Don't move away here or there, creating panic. Remember, less is more. So it's all right. Just wait. Give it time. Remain quiet and calm. Less is more is specifically for the language. So the less language you use there, the better it will be for the child. When the child is undergoing a behavior, eye contacts minimized, language minimized, it helps the behavior to come down very quickly. Do not take behaviors personally, even if the child is talking something which is, not acceptable. Don't take it personally at that time. He doesn't know what he's saying. And at times, even in the most stable situations, kids do blurt out things which they do not understand or they do not mean. So try not taking anything personally. Disengage yourself emotionally. Don't feel that, oh my God, my child, what is happening to my child? What do I do about it? And start feeling emotional and crying yourself that why is it happening to me? What should I do? Why do I have to go through this? No, please detach yourself emotionally. Understand this is just a phase. It is just a phase which is going to probably not be there after 5 minutes. Be conscious of your non-verbal cues. So it is not just talking that matters, it is also your eye contact, your body language. If you're not saying anything but showing irritation on your face, making continuous eye contact, giving him a glaring look, so that talks way more than your words. So avoid those non-verbal cues. Taking deep breaths. So basically keep yourself very, very calm. Rage interventions. So things to be taken care of. You have to protect the student as in the child, and you have to protect the environment, protect everyone. So nobody gets hurt. So don't discipline. No discipline happens during that strategy. Remove the audience if needed, or maybe remove the child from the situation if you cannot remove the audience. We don't want everybody, because that is just a temporary phase. So we can try minimizing people there to further lessen the duration, because if too many people are around, it only leads to the prolongation of the behavior. Follow a plan like you already have in your mind that, okay, my child is on spectrum. I do expect some meltdown. So I'm going to just let it go through, let it pass. Obtain assistance if needed. If you need any help, you're not able to handle the child, you feel that he'll get hurt or he might just hurt somebody, take help. That's all right. Then same things. Don't go for power struggles, be flexible and follow those things. During the recovery, now recovery behaviors, after the meltdown is done, we see certain behaviors in the children, like they might feel sleepy, they may deny rage behaviors that no, I did not do it, or no, I did not mean it, or withdrawal into fantasy. So you see those zoning out phases, apologizing, I will not do it again, and fragile, like very shaken, very broken. So any of these behaviors we can see after the rage phase. So what do? Accordingly, you have to support the child. If the child feels sleepy, let him sleep. If the child feels, too apologetic, don't feel like, no, it's all right. Just very clear, very calmly tell the child that this is what happened and you got upset. We can do this. So if now we know that this particular trigger or this particular situation is happening repeatedly, we probably start with a social story when the child is in a good mood. And tell the child at that time, provide sensory inputs if required, provide calming strategies if required. So whatever the child needs to calm down quickly and immediately, and try redirecting him back to the activity. So now after all this, what should we do? Now we have a behavior, so now we need to discipline the child. What strategies we can employ for that? We can use, again, discipline itself has a complete strategy set. So distracting, we can distract the behavior. So in the rumbling stage itself, if we redirect the child, we distract the child, probably we will not reach the rage phase. Okay, so try distracting, investigating needs and feelings. So this is for us as parents. Structuring the environment. There can be certain environmental issues which can act as triggers. Triggers will be there which are causing the problem. Many a times, you get a complaint from the school that the child is behaving in a certain manner, and without thinking, you just start correcting the child. Don't do this. You're not supposed to do this. If you do this, you get this consequence. The child comes home, repeating the same behavior. He gets a consequence, which further irritates the child. So we have to understand what is happening in the environment or what is happening as a trigger before that. Is something going on which is triggering my child to do it? Is something happening which he's not liking? So you need to also investigate what is happening in the environment, and just before that is the antecedent. So antecedent is very, very important. Do not undermine the importance of antecedent. Consequence is not as important for a behavior identification as is the antecedent. Consequence comes for the behavior modification. But why this behavior is happening, the antecedent will answer you. See, consistency. So consistency has to be, yes, definitely maintained. So if you want a behavior to become a habit, you have to be very, very consistent. It's not that one day my child showed a behavior, I was strict, no, you're not doing this, no matter what, I'm not giving it. Second day, you are like, acha, theek hai, I'm very tired, let it be. You cannot do that. So you have to be consistent in your strategies, no matter how much you're tired, no matter how much you're overworked, keep everything aside. We cannot let the behavior fall, behavior modification plan fall for any reason. The consistency is required. Instructing whatever the child is supposed to do, telling him what to do, playing and connecting. So this I was already talking about in each webinar. Playing and connecting is very, very important. If you want the child to listen to you with calm voice and everything, so that connection is required for the child also. Why should he listen to you? He needs to be connected to you. L for limits. So we have to set our expectation limits very clearly. We have to set the child's limit very clearly, that what I expect from you and what you can do. So up to this, I can accept, but beyond that, no, it's a clear no. Ignoring at times. Sometimes we just have to ignore a behavior. Noticing positive behavior. So whenever a child is doing something good, you should notice and appreciate. And excusing self for the child. So sometimes you just let go. So you need to choose which strategy you're going to employ at what time. It's not that there will be one fixed strategy for one behavior for every child. No. Even contextually, the strategies can change. So according to reinforcement theory, there are basically 4 types of consequences we attach to for behavior modification: positive reinforcement, negative reinforcement, punishment, and extinction. So positive reinforcement, what is reinforcement? So reinforcement is anything that I'm adding on or I'm removing from the environment as a stimulus to encourage the desired behavior. So there is a behavior which I want. So to increase that behavior, either I add on something or I remove something. So suppose I want the child to study for a certain time. Okay, say for half an hour, and my child is taking probably 1 hour to do the same thing. And what happens after that is the suppose TV time. Okay, so half an hour, positive reinforcement will be that I told my child that, okay, you do it for half an hour, quickly finish it, and you get ice cream. So this is positive reinforcement. Negative reinforcement is if you do not finish it in half an hour, then your TV time is gone. Okay, but it is not a consequence. I'm just taking it out from the negative, from the environment. Or suppose if my child is not writing properly and I want him to write properly. So maybe that seat was not comfortable. So if I change the seat of the child, then the behavior becomes, the desired behavior is achieved. So anything that you're removing to get the desired behavior acts as a negative reinforcement. And negative reinforcement is not bad. It is also good because ultimately the aim is to promote desired behavior. In positive, you add something, In negative, you remove something. Punishment is when you add a negative consequence. So when you are adding a negative consequence, then like we do that, we have scolded or we hit or we give a severe consequence. So that becomes a punishment. And extinction is when new behaviors remove positive consequences. So if you were giving attention to the child for something, and if he did not behave in an appropriate manner, he doesn't get your attention anymore. So that is extinction, that is removal. Let's understand it more simply. So positive reinforcement, person repeats the desired behavior to get a reward. In negative reinforcement, person works to avoid an undesirable result. So the child will finish the work quickly because my time is going. So if I do not finish it in half an hour, I lose it. So I'm not doing anything. I'm just removing that time from the timetable. Punishment is a response which causes something negative to occur. So whatever the child did and response to that, you did something negative, which most commonly happens in terms of hitting or scolding or things like that. Extinction, unlearning a response because of a change in consequence. So suppose a child starts, takes up a negative behavior, and I do not want to encourage that in any way. So I'll just keep on ignoring it. When he will not get attention for that thing from me, probably the child will stop doing it because he is not getting the response that he wanted. So the consequence has changed, absolutely ignored. I'm not talking to you if you're doing this way. So you are just changing the way you are behaving with the child to unlearn that response. Things to take care of now. So when you are going in for behavior modifications, you have to set very clear expectations. It won't be a broad scaled or very haphazard plan. It has to be very clear, short goals, and set very clear expectations that this is what I desire from you. So if I'm encouraging a sitting behavior, so I have to be very, very clear. It's not that I want the child to sit for long duration. This is not a goal. The child should sit for 2 minutes, child should sit for 5 minutes, child should sit for 7 minutes, child should sit for 10 minutes. So that's how you quantify it. There is a very clear expectation attached to it. Modeling. So you have to model positive behavior. So that is where your positive discipline and your mindful parenting comes into play. So if you are modeling those positive things, that I'm sitting with you with my full attention, no mobiles, no TV is happening. So you are modeling a positive behavior to the child. Consistency. At the same time, we're doing it very consistently. We're doing it. So if you do something nice, you get this. If you're not doing something, then you get this consequence. So my consequences are decided and I'm very consistent about them. Acknowledge. Acknowledge the positive changes. Whenever you see that the child has done that desired behavior, do acknowledge the child. That really tells them what are they expected to do. Because if they're doing something and I get acknowledged for something, next time I'll try to repeat it. Here, the acknowledgement now can vary. It can be a social reinforcement. It can be a tangible reinforcement. That depends on the child. And evaluation. Finally, you see, where we are standing. So this is in brief about behaviors and how you assess the behaviors and how you go in for modifications of behavior. I'm open for any questions. Any queries on the topic?
Ma'am, in the first slide, you talked about the synaptic pruning, right? In autistic children, is there any test or scan can we do to identify whether the synaptic pruning is not done, it is not properly done or something like that? And
yeah, probably this question you can put in our question and answer section, because Dr. Lalit would be the right person to answer that.
Oh, okay, ma'am. Yeah. Okay, ma'am. Yeah. Thank you.
Yeah. So I guess if we're all good, then we can close today's session.
Yes, ma'am.
All right. Thank you everybody for joining in, and we'll see you probably Krishnati, do you want to ask something?
No, ma'am.
Okay. So we will
Thank
be
you, ma'am.
welcome, ma'am. So we will be scheduling a question answer session probably next Tuesday, or we will just inform the day and we'll see you there. So bye. Have a good day.